Hi everyone. What I'm going to do today is model for you the express consent discussion for working on the chest wall and providing breast massage for a male. This is my husband Carol, and he's going to be my model patient for today. So Carol, tell me what brings you in.
Well, I decided recently that maybe I should go back to jogging, and probably I'm suffering a little bit of pain from that. And when I was jogging yesterday, I found that there was a bit of a stitch. I guess they call them stitches.
Mm-hmm.
And as you're jogging along, you sort of go like this.
Yep.
And then the right side has been bothering me, and it emanates down through here
Okay.
from work that I do with wood and machinery.
Right.
So
Right.
those two things.
Okay. What I would like to suggest for you then is a treatment for the upper chest wall and into the sides here, and that would include a breast massage. Would you
Okay.
like me to tell you about that?
Sure.
Okay. So how we do this treatment, or first of all, why we do this treatment is that we all have breasts, male and female. Male breast is slightly smaller than women's breasts, but has the same geography, and the breast sits in a fascial envelope, like a gland that sits in an envelope on your chest wall.
Okay.
And then underneath that are all the muscles and the structures that help you move around. So when you get a stitch, sometimes it's muscular, sometimes there's a fascial adhesion. I know you've had some injuries in your right shoulder, so there may be some trigger points coming up here. So what I would like to propose is that I will have you lie on your back
Okay.
and head up this end, and I can undrape you in a variety of different ways. I can either work right here on the central part initially and then undrape one side at a time, or I can undrape both sides at the same time. Sometimes people get a little cold when I do that, so I favor undraping one side at a time.
Mm-hmm.
But I'll start working here on the side and work to the middle.
All right.
The reason for that is that if there's any kind of congestion or swelling or anything like that in your chest, the lymphatic channels are up in the middle of the body. So that's what I'm working towards, a combination of the myofascial and also the fascial and then the lymphatic work.
Wow.
The benefits of this are that we can probably take care of the stitch and probably take care of the trigger point, I think. Yeah, get rid of any pain that you've got. In addition to that, you may feel just kind of light and more comfortable in the front of your body because we don't often get this part of ourselves massaged or touched.
I don't think I ever have.
Yeah, so I think you'll feel a little freer because of that opening through the chest. I don't hear from anything that you've described any cautions or contraindications. If you had any sudden nerve-like sensations, I would stop. If we found any sort of strange lump or presentation in your body, we would make sure that you get that checked out.
And that doesn't come through trigger points or anything like that?
No. It almost never happens, but if it did, I would refer you to your doctor at that point. So I'm not anticipating any of that at this stage. No cautions, no contraindications. It takes about 10-15 minutes to thoroughly work the upper chest on one side, so it's about a half-hour treatment altogether. Do you have any questions for me?
No, I don't know.
No? Okay. And would I have your permission to go ahead with this type of treatment?
Yeah,
good.
For sure.
All right. So just before we start, what I'm going to do is have you sign permission for me to work on the chest wall and the breasts, because that's required by law.
Okay.
Okay?
Yeah.
All right. Thank you.